Hello there, my name is Eugene Anangwe. This is a CNBC Africa special considering the fact that on March 5th to the 8th of 2023, Africa's top thought leaders, political figures, innovators, researchers, policymakers, health workers and community mobilizers will be convening right in the heart of Rwanda, Kigali, for the much needed, long awaited and probably long overdue dialogue and action on mainstreaming climate discourse into health policy conversations and vice versa. And this will be taking place at the Africa Health Agenda International Conference 2023. Dr. Sabin Nsanzimana, who's Rwanda's Minister of Health, and Dr. Ahmed Ogwell Ouma, the Acting Director AFRICA CDC, are joining me now to put perspective on this. Thank you so much, Honorable Minister and Dr. Ouma, for making time. I want us to start from the perspective of the lessons that we have learned. We cannot be able to push this aside. We are still looking at how COVID-19 hit the continent and the world at large. What progress, Honorable Minister, do you think has been made so far in strengthening Rwanda's ability to detect and manage outbreaks of diseases and pandemics of COVID-19 magnitude in the event that we were to be hit by another pandemic right now? Do you think we're ready to handle?
Thank you so much, dear Anangwe, and my brother Ahmed. It's a great pleasure to join this conversation. As you rightly said, preparedness and response to the next outbreak and pandemics, it's not something you do one time and stop. And the lessons you learned from the previous experience always help you to move even better. So as a country, we've learned from the previous experiences when COVID-19 was starting. We're still there, but also other outbreaks that we've been facing in the past that helped indeed to respond to COVID-19. But it's not an issue of a country. A pandemic, as per its definition from a basic epidemiology, is actually something that goes beyond one country's borders and a continent. So it's borderless. So we look forward to have this experience exchange, what worked here, what worked in North Africa, West Africa, South, and even beyond, that can be applied, and we can prepare better here so that whatever an outbreak emerge from one part of a country is not going to be a pandemic next time, because you have the power to stop outbreaks to become pandemics. But most of the time, these outbreaks are happening and starting from one single case to become an outbreak, then to become a pandemic. So the early detection is the key element, diagnostics, data, being open to share and learn from others. These are all the things we are looking for to continue to upgrade and also invest in a system that when a new outbreak hits on a pandemic, we are ready. We can respond with the fastest ways to stop it to spread.
Yeah, and I'll switch over to Dr. Ouma. You've also exuded the level of confidence that the continent is not at the same place 6 years ago since the Africa CDC was set up. I want to understand from your perspective at a continental level, where do you see or how would you be able to gauge the continent's and your institution's readiness to tackle pandemics or the nature of diseases that we've been able to see over the past, 3 years? What gives you this level of confidence? How do you feel, or what is it that shows you that these are the indicators that show that we are ready as a continent?
Anangwe, thanks for inviting Africa CDC to participate, and a pleasure to be here with my brother Sabin, Minister of Health of Rwanda. Africa CDC celebrated the 6th birthday just the other day on the 31st of January 2023. And we've come a long way from 2017 when Africa CDC was officially launched to where we are currently. We handle roughly 110 or thereabout outbreaks on the continent of Africa every year. But you will see that very few make it to the media because the vast majority are arrested at source. This tells you that African countries have built some capacity over the years. Enter Africa CDC, and we've been doing quite aggressively building the capacity of our member states to be able to have decent early warning systems. And as Africa CDC ourselves, we are also providing support to the African Union member states whenever it is that they need it, if an outbreak is big or if it cuts across countries. So I'll share two very important indicators that make us more confident than we were 6 years ago. One is the confidence that Africa CDC has received from the Africa Union member states. We have the confidence of our governments, and therefore we work with them very closely. This close coordination makes it easier for us to be able to arrest outbreaks. Second is the capacity that we have built as Africa CDC. When we started, we were barely 10 experts. Today, we are over 250 experts, which means we have much better reach in terms of support to our countries whenever it is that we are needed, when an outbreak seems larger than one particular country can be able to handle on their own.
Right, and this will now, push us to the conversation that we are about to actually have on this particular one, and I'll bring the Honorable Minister, Dr. Sabin, on this one. The Africa Health Agenda International Conference 2023 that will be taking place right here in Rwanda will be seeking to push for mainstreaming climate discourse into health policy conversations and vice versa. The question that comes to mind is, why do you think it's important to integrate climate considerations into health policy conversations, and how do you see this benefiting public health outcomes?
I think this is a very fundamental question you're asking, because it tells us where the disease is coming from. We have a principle of the relationship or the ways humans, animals, and environment live together. That is medical or epidemiology terms, public health terms, is known as One Health principle or aspect. But it tells us how each of the three elements of this triangle can be useful or can also be a source of infections or diseases to the other, animals to people, people to animals, or environment to animals to humans. So it's vice versa. So and this connects to the point you highlighted of climate change, because this is all about the environment we live in. When the temperature increases or decreases, it is a factor that will help some pathogens and diseases, viruses included, to have a better environment to grow, to transmit, to even change themselves, different from how they were before, when the environment were stable and the balance between the animals, humans, environment was at a level that you control certain level of diseases. So any change, any disruption that happens to that relationship will inevitably create certain conditions for disease to emerge that were not there before. And that is what is going to be a discussion for us during these conferences. And it brings the bigger picture on how we should protect our planet in a public health context at a larger scale, by ensuring that we humans, we don't create diseases ourselves. And whenever they happen, we are ready. As my brother Ahmed mentioned, the diseases may happen, or will continue to happen actually. But we have the power to stop them from the source and extinguish the fire before they burn our houses. And this is all about the discussion we're going to have here in Kigali very soon. We are glad that our brothers and sisters from Africa, scientists, researchers, with Africa CDC and other partners, we're coming together and speak the same language, because when an outbreak starts, it will, in a few hours, spread across the world, different from the past 50 years or 100 years, where we should have an outbreak on one continent, because there was no traffic or travels. You could, even without major actions, that could stop itself. But today, within just 6 hours, you have crossed the world, and this is how COVID started. and now it's everywhere.
Right.
So maybe I can pause there, but that is the principle, and that is the reason why we're focusing on climate change as an important factor.
Yeah, yeah, and this is why we bring in Dr. Ouma one more time. Mainstreaming climate discourse into health policy conversations, Dr. Ouma, and vice versa, very key, but seemingly long overdue. What has been the missing link? Why have we taken too long to start feeling like it is very important for us to have this kind of conversation?
Arangwa, we've not taken long. We have been handling the causative environment for many of these outbreaks at source. We've just not been discussing it loudly. As public health professionals, we've been very busy preventing and then responding to outbreaks when they come. But now we are making it a more visible topic for discussion. And I think that is a part of the reason why we have this as a concrete element of this particular conference that is coming up next month. We are also now systematically involving colleagues from environmental health, colleagues from animal health, as my brother Sabin had said, the One Health approach. And we are also making it clear to the public that we are not only working within the human health space, we are also working with colleagues from animal health and environmental health. Indeed, climate change is becoming a complicating factor for our work within health, and we want the public to be able to understand that. Considering the fact that any part of society that fails, it becomes a public health problem, whether it is engineers who build our roads, whether it is our water engineers who keep our water clean, whether it is climate change, if we misuse the environment, whatever fails, it becomes a public health problem. And as public health professionals, we are now moving into the space of prevention, into other sectors a lot more aggressively, if you want, so that we do not have to deal with the consequences of failure of a particular part, and climate change is one of them.
Right. And you mentioned whatever fails, it becomes a matter of public health concern. And I want to bring in the Honorable Minister. A lot, Honorable Minister Dr. Sabin, is actually already in our faces in terms of, problems or challenges. We've talked about issues of food insecurity. We are seeing more infectious diseases and extreme weather patterns are actually exacerbating the situation and threatening the health and well-being of populations. When you speak to your peers within the health spaces across the continent, do you gather a sense of preparedness at a continental level to tackle these issues from an interlinked perspective of climate change and public health, perspective?
Absolutely. And actually, last week we were in Addis Ababa with my brother Ahmed, African Union Assembly. We had a chance to meet different ministers of health and other leaders, including heads of states who were gathering for Africa, thinking how we can actually improve our continent. And health topics were discussed largely, including this pandemic. And as we speak, there are actually outbreaks that are active, happening. And probably at the end of this conversation, there will be an outbreak starting somewhere. But again, the power we have is to know it and stop it as soon as possible. The issue of climate change comes in now because we see the effect coming more clearer, but it has started in the past. So the challenge we have here as a continent is the disease burden for this continent is much, much higher than to other continents. So we have actually to double our efforts and our energy and our thinking, our innovations, because we have the problem here. And as we speak in our local language, actually, maybe in English, we try to say, the solution is within. You don't expect it to be coming from far. So we have the disease burden on our continent. And if you look on the other side, the solution, the research output, Africans, we contribute to the world scientific arena is only 2%. So we have to catch up very quickly to make sure we detect diseases, we know it, we bring tools to solve our own problems. And also we can bring solutions from here in the South, in Africa, that can help in the North, and vice versa. So this is a major lessons we learned. And as we meet, as we discuss with sisters and brothers, ministers and leaders across the continent, everyone speaks the same language. And what we're now going to be discussing next month here in Kigali is how do we put our commitment into actions and fast? And how do we bring the evidence and facts into practice to solve these problems? We are better than last time, but we need to be much better because these diseases are coming up with new ways of changing themselves, what we call variants to this. At least for COVID-19, everyone knows what variant is, but all diseases or viruses are changing themselves. So we must be much clever, much smarter to outrun and be ahead of these diseases. And that's the reason why I think having these conferences, put it in a larger context, bringing scientists, policymakers, and community and media together, we can pass a strong message and go back and assess how we are progressing before the next pandemics happening.
And for you, Dr. Ouma, I mean, what are the flags, the red flags that you see in terms of challenges that are likely to be encountered by stakeholders when, you know, they're willing to actually start incorporating these conversations or having them within the policy frameworks? But, you know, what challenges do you foresee? And how would you recommend these challenges to be addressed from a policy-making perspective while, you know, intertwining these two things, climate change and the health sector?
I see the challenges as captured by Africa's new public health order. The first challenge is getting institutions to be ready to handle climate change and health nexus in an efficient way. We need to build the capacity of our institutions, those that deal with health, human health, animal health, climate, and we make sure that they all see themselves as one team. Second challenge is getting appropriate expertise on the continent. How do we make our human health experts to understand climate change? How do we make climate change experts to understand the human effect of climate change, and how do we get environment colleagues to also appreciate the human health angle? So getting experts to be able to speak together, plan together, getting them in the right numbers and in the right places on the continent is very key. Third is how do we get our governments, our private sector, our non-state actors on the continent to be able to speak with one voice? Because different agendas are being pushed from different angles, depending on someone's immediate sector. We need all those to come together so that all the local resources that we have can be brought to bear to address this nexus of human health and climate change. And finally is the need to develop and strengthen partnerships very broadly, not just within the continent, but beyond. We know we must do this ourselves, but we don't have to do it alone. We need to build networks and partnerships, collaborations that are going to bring new expertise, new knowledge, new experience onto the continent so that we are able to address climate change and human health nexus in a very efficient way to protect the African countries from the effects of the health effects of climate change and health. So it's really those are the key challenges I see, and we're already walking the path as Africa CDC, building this broad coalition across the continent, across sectors, and across partnerships to ensure that climate change is being addressed efficiently. One more thing that I would like to add is we are having this conference focusing on climate change and health because Africa has come of age to be able to organize its own meetings, bring its own experts, and facilitate that conversation that is extremely, extremely valuable in the continent, building solutions in an innovative way based on our own experts and our own resources here on the continent. We've come of age to build and deliver very good meetings that are going to provide recommendations that we can be able to use to address climate change and health nexus.
Right. Honorable Minister, you have the last word. And on this one, I want to ask you, because of time, I'm seeing we're already running out of time. How can forums like the Africa Health Agenda International Conference inspire meaningful collaborations and ensure stakeholders walk the talk? And in what ways can countries measure the effectiveness of their climate and health policies and their impact that they are having on health outcomes and environmental sustainability from where you sit?
Thank you very much. I think this is important now that we are thinking in different ways, because we've seen how much when we affected as countries, as a continent, the cost is high. It goes beyond health to economies. And this meeting happening next month here in Kigali, we build on the challenges we had and the lessons we learned, and how we're really going to discuss things that are going to be put into implementation. Looking at the data, where we came from, where we have to go, because if we delay more, it's going to affect us more. It's going to affect our economies. Our Minister of Finance understands this much better than it was 3 years ago, because when one virus came, it stops everything. So the framework and the timing is different, but I believe also the understanding and how we believe we are all eager to go back and change our public health systems, strengthen our facilities, our preparedness and response systems, and how we communicate and share data. Now we have Africa CDC that is also getting more and more capabilities to help countries. And also we have our own scientists looking into where the next pandemic is coming from and how my neighbor or my sister, my brother can come and help without waiting someone who is coming from very, very far. So we have, again, solution within. Let's use them. This will be the discussions. We're going to forge new relationships, new ways of working faster and better. And I believe that it's not just a meeting, it's also the framework and how we help each other to stop a common threat.
Thank you so much, Honorable Minister. Dr. Ouma, I mean, why is this conference a must attend in under a minute, if you can?
The Africa Health Agenda International Conference happening in Kigali the 5th to the 8th of March 2023 is the place to come and discuss how Africa is approaching health and climate, and also how partnerships are being built across a sector. So be there. I will be there, and I hope to see you at the conference in Kigali next month.
Thank you so much, Honorable Minister for Health, Dr. Sabin Nsanzimana, who has been joining us right here, and of course, Dr. Ouma, who's also joining us right here. He's the Acting Director Africa CDC. Thank you so much for being a part of this conversation, and we hope to see you at the conference right here in Kigali, Rwanda. From me, right here at CNBC Africa, I want to say thank you for watching. As always, my name is Eugene Anangwe. Goodbye for now.